Welcome to episode 11 of What Do You Think, Utah? Feeling the pain of abortion is the title of this episode. Utah now has a new law requiring doctors to give anesthesia to abortion patients 20 or more weeks into pregnancy to reduce pain that may be felt by the fetus. That's the purpose of the law, its stated purpose. It's the first law of its kind in the United States. Can a fetus feel pain? That's the issue that was hotly debated during hearings on this new law. Most doctors, well, many doctors, are dubious, saying that fetal pain perception is unlikely before 28 weeks, although there are some doctors who disagree with that. What is surely true is that this new Utah law gave rise to some acrimonious and painful debate during the last legislative session. There are still a lot of questions about how the new fetal pain law will be administered, and there will assuredly be more difficult moments to come for women who are already dealing with the painful decision to seek an abortion. Let me introduce our guests, and then we'll get right into the discussion. Just to my immediate right, Dr. Leah Torres. She's been providing high-quality reproductive health care to Utahns and their families since moving to Salt Lake City in 2012. She graduated from the University of Illinois Chicago College of Medicine, completed OB/GYN residency training at the Albert Einstein Medical Center in Philadelphia. Her practice consists of a range of obstetric and gynecological care, including high-risk obstetrics, infertility care, abortion care, and everything in between. Dr. Torres completed the Family Planning Fellowship at the University of Utah. So almost kind of ironic that she came to Utah to learn how to perform abortions. Is that pretty accurate? She is qualified to perform first and second trimester abortion procedures and holds a Master of Science degree in clinical research. Also with us, Dr. Lexi Grosvenor-Eller. Is that how you say it's Grosvenor, right? Yeah. She is an obstetrician, a gynecologist for Intermountain Healthcare, and an assistant professor in the Department of Obstetrics and Gynecology at the University of Utah. As a high-risk obstetrician, Dr. Eller specializes in caring for women with medically complex pregnancies, fetal conditions that require specialized care and surveillance before birth and prenatal diagnosis. She lives here in Salt Lake City with her husband, who's here tonight, I think, yes, and 2 young children. Deirdre Henderson, first elected to the Utah State Senate in 2012. She and her husband, Gabe, have been married for 22 years. They've built a successful business. They raised their 5 children in Spanish Fork. In January of 2008, Deirdre worked on the congressional campaign of Jason Chaffetz, and after Congressman Chaffetz was elected to the U.S. House of Representatives, Deirdre ran his political operation for a while, and then I guess decided, why not give it a shot myself, and decided to run for the office that she currently holds, a state senator in the Utah State Legislature. She's a member of the Mountain View Hospital Board of Trustees as well. And then to the far right, perfect. Our good friend.
I see what
it was not. There. It was not by design.
It's funny because my Republicans say I'm not right enough, but to you I'm far right. So
yeah. Well, I would say you're not. we won't get into it. Dr. Todd Weiler.
I like doctor.
Well, then work a little harder.
I'm a juris doctor. I'm a juris doctor. Does that count?
Yes, he's a doctor of the law. He has a business and law degree from BYU. He graduated cum laude in 1996 from the J. Reuben Clark Law School, where he served on law review. He currently serves as Senior Vice President and General Counsel for the company Logistic Specialties. Before joining the Utah Senate in 2012, Todd served on the City Council, chair of his local Chamber of Commerce, county political party, married Elizabeth Gordon in 1991. They have 4 children, and nice to see you again, Todd.
And I'm also on a hospital board. So.
All right, you just came from
a
board meeting,
yeah.
Hospital board meeting. We got very shortened bios. These are all very distinguished. people. The two doctors here, very distinguished. Deirdre Henderson serves on many committees in the Utah State Legislature, as does Todd Weiler. All right, let's start with Senators Weiler and Henderson. Both of you, I believe, sat on the Senate committee that heard testimony on Senate Bill 234. That's the fetal pain bill that was signed into law by Governor Herbert. Now, as I read accounts of that hearing, most of the and please feel free to correct me if this is not true, but as I read the accounts of the hearing, most of the doctors who testified were not in favor of the bill. Most of the doctors who testified. What convinced you, in spite of that testimony, both of you, that this fetal pain law was the right thing to do?
Well, thank you. First of all, it's a pleasure to be here. I appreciate the invitation. What convinced me is the fact that we don't know for sure, and no doctors could say definitively, that an unborn child in that gestation period can't feel pain. And so to me, it was why err on the side of, let's err on the side of caution. If there's a possibility that they can feel pain, and there is some evidence to suggest that they can and do, then why not err on the side of compassion to the unborn child?
Todd?
Thanks. I communicated with over 30 doctors before voting on this last February, and we also, I think it's worth pointing out, we have 5 MDs who are in the legislature, and all of them practice medicine. And I think they're all Republican, which weighs into this, but all 5 of those doctors voted in favor of this bill. Dr. Shiwazawa, Brian Shiwazawa, is an emergency room physician at St. Mark's Hospital. He voted. He's the only one in the Senate, the other 4 in the House. And I think everyone is entitled to their own opinion, but people are not entitled to their own facts. And these facts I found very persuasive. The New England Journal of Medicine reported that by 7 weeks, a fetus or pain sensory receptors appear in the mouth area of a fetus. By 10 weeks, the Encyclopedia of Human Biology says all components of the brain and spinal cord are formed, and nerves link the stem of the brain and spinal cord to all tissues and organs of the body. The Fetal Diagnosis and Therapy Journal says that by 14 weeks, pain transmission from a peripheral pain receptor to the cortex is possible and completely developed by 24 weeks. But at 14 weeks, it's possible. And by 14 to 22 weeks, according to Fetal Diagnosis and Therapy, physiological fetal reaction to painful stimuli occurs. By 18 weeks, according to the New England Journal of Medicine, pain sensory receptors are spread to all skin and mucous surfaces. And by 20 weeks, according to the American Medical Association Complete Medical Encyclopedia, the fetus sleeps and wakes and hears sounds. So, I asked over 30 doctors, I communicated with over 30 doctors, and I asked everyone the same thing. Can you tell me to a medical degree of certainty that a 20-week fetus does not feel pain? They all said, no, we cannot tell you that.
All right, that does lead into my next question, but let me ask you something just as a point of clarification about the doctors who are in the legislature who voted for. And Shizawa, you mentioned, it seems to me that I read that Dr. Shizawa, and I don't know what his specialty is.
He's an emergency room physician.
Expressed some reservations about this particular piece of legislation, and yet voted for it anyway.
No, he voted against it until an amendment was made that was being pushed by the Utah Medical Association. Once that amendment was made, he supported it, and the Utah Medical Association did not oppose it. They took a neutral position.
You're right. They said, well, we're going to, as wisely as we can, step back from this.
But they wanted an amendment, and Dr.
What was the amendment?
It was a change. Last year in Congress, the House of Representatives heard extensive testimony, and they passed a resolution. It did not pass the Senate, but it passed the U.S. House, that said that 20-week fetuses will feel pain. And so the original bill required doctors to give that notification to their patients before an abortion. The amendment was to change the word will to may. So it may feel pain.
All right.
So it softened
now,
it.
let's turn to our doctors here on the panel. You've heard what Senator Weiler had to say. Senator Henderson, err on the side of caution that perhaps a fetus at 20 weeks might feel pain. We'll have both of you address this, but Dr. Eller, let's start with you. Most doctors seem to say, Todd has his facts, but most doctors that I read about seem to say that the fetus probably doesn't feel any pain up to 20 weeks, but is there any way we can be sure of that?
So, as you know, it's really impossible to prove a negative, right? I mean, it's very hard for anyone to do that. And it would be unethical to say absolutely 100% no, there's no way we could know that. But based on our understanding of what pain is, based on our understanding of neuroanatomy, we don't feel that that's likely until closer to 28 weeks. Now, let me get back to why. What is pain? Pain is an emotional and a psychological response to noxious stimuli that involves consciousness and cortical connection. Okay? Spinal reflexes, removing yourself from a noxious stimulus, those happen at the level of the spinal cord, not at the level of the cerebral cortex. So you could have a response to stimulus, and no one would argue. I mean, I use this to my advantage every day. I scan babies, and I push on them, and I make them move over so I can see what I need to. When we perform sometimes life-saving fetal interventions, like a transfusion, for example, I might even use a needle inside the maternal abdomen to kind of poke the baby a little and get them to move so that I can perform a transfusion to save the baby's life. So we know they respond. We know they have spinal reflexes. But the neuroanatomy, including all of these things that you describe, I agree with what you said. But the difficulty is that the spinal reflexes are present from an early gestational age. The spinothalamic tracts, these are the connections between the spinal cord and the central part of the brain, which translate painful stimuli, are present probably at that stage. But the thalamocortical connections, that is the connection to our thinking part of the brain, our perception, our cognitive ability, if you will, is simply not formed anatomically, histologically under a microscope until later in gestation. Could there be preliminary pathways? I suppose, but the neuroanatomic data doesn't support a thalamocortical functional connection until closer probably to 28 weeks. Now, an example I think may be helpful here. We care for women sometimes in pregnancy who have paraplegia, who have spinal cord injuries, okay? So if an individual has had a spinal cord injury somewhere in their thoracic, chest level spine, they may have no motor function, no sensory function below that level, okay? So this actually becomes a problem for women who are pregnant because the normal painful stimulus of, say, a bladder infection, a kidney infection, contractions in labor, they don't feel. They have all the physiologic responses to pain. Heart rate changes, blood pressure changes, sometimes life-threatening degrees of these physiologic responses to painful stimulus, but they are not consciously aware. They don't perceive their pain, okay? And it becomes a problem. They have out-of-hospital births, and they get very sick sometimes because they don't know they're having pain until they're far down the road of an infection. Now, in a woman with an injury like that, her inability to perceive pain in the same way is because of an interruption in that pathway. In the fetus, the reason that most of us believe that they don't feel pain is because they simply don't have that thalamocortical connection to perceive pain in the same way. So it's a similar idea. Yes, these studies, I don't disagree. You get, fetal responses to needle procedures with increased heart rate. I've seen it on the ultrasound, right? You probably do get a cortical stress response and cortisol level changes just as those women do who have noxious stimuli, even though they don't perceive or feel pain. So that's, I think, our kind of understanding and perception of why anatomically we kind of disagree with this premise, even though those things that you listed to me, I agree with, right? But no, of course, no one who's being honest will ever respond to that question, absolutely not, because you would be lying. Just as I would be lying to a patient if I told her there was substantial evidence the fetus will feel pain.
Dr. Torres, when, if ever, is anesthesia used during an abortion procedure?
We give the pregnant person anesthesia either orally or through the IV. At any time in their pregnancy that they choose to have it, it's optional as far as IV can be extensive in the early pregnancy in the early trimesters, and so it's not always necessary, but definitely in the second trimester procedures, IV sedation and anesthesia is used, but not in the patient isn't put to sleep, the patient is awake, but sedated and comfortable.
So that's just for the comfort of the patient. Do we have any evidence that it has any effect on a fetus in any way.
Well, the only things that we can say is whether or not drugs that we use cross the placenta. The concern that I have is that I don't know what a fetal dose of fentanyl is. I don't know what a fetal dose of propofol is. I don't know what anesthesia means to give to a fetus. I know what it means to give to my patient, but I don't know what it means to give it to a fetus, which is what this bill calls for, what this law calls for. And so my question has been, how am I supposed to do this? Or how can I avoid breaking the law? Because I'm not sure how to administer this medicine. Am I giving her an ibuprofen because that crosses the placenta and therefore I have given the fetus anesthesia? Or do I have to use a method that Dr. Eller would use and place a long needle in her abdomen and give the fetus anesthesia that way? And I don't have an answer yet.
How often is this likely to come up? So the law says you have to. It used to be that you said you can offer it, but now you have to administer. Is that right?
The mother, the woman, the patient, has had the right to choose anesthesia for the fetus for many years
Right.
in Utah.
Right.
And so those same questions
Yes.
could have been asked.
Yeah. So, but now it must anesthesia must be
Only past 20 weeks.
only past 20
And
weeks.
abortion is illegal in Utah after 21 weeks. So we're talking about 1 week, a 1 week period
not true.
Right.
where less than 1% of the abortions occurred. We're talking about maybe 17 abortions per year in Utah.
Yeah, Dr. Eller.
So when we talk about termination, so this law refers to terminations of pregnancy after 20 weeks. That's what it says. So when women terminate a pregnancy after 20 weeks, there are two basic ways to do that. One is a surgical dilation and evacuation, surgical procedure. The other is induction of labor. And in fact, in the state of Utah, across the country, 1.3 or so % of abortions are after 20 weeks. Particularly in the state of Utah, this is very rare. The vast majority of women who are undergoing a termination after 20 weeks are doing so for a maternal medical indication or for a fetal abnormality. Some of those abnormalities are lethal, and they are sort of excluded from this discussion. But many of them are non-lethal but severe, and women choose to terminate. Many of those women choose induction of labor. So this is labor like anybody else experiences labor. So if you listen to what this bill says termination of pregnancy over 20 weeks, have to tell the patient it could cause fetal pain, you have to treat fetal pain. So a lot of these women are being induced. So the ramification of this is that induction of labor is painful for the fetus, and we need to treat fetuses for pain in labor. Now that has a lot of implications because we don't treat any other baby in labor for pain.
But doesn't the baby, before it's induced, have to be killed?
No.
You don't
These
have
women
to
are
inject
induced.
it
No.
can't be born
in
alive,
fact, In
though.
fact, we would, in many cases, like to offer that to women, but we haven't been able to. So no, in fact, we don't do that. They are induced in labor and they deliver a baby that is either born stillborn or born and lives for a very short time in the comfort and loving arms of their parents who grieve their loss. And the reality of this bill, and part of the reason so many of our patients reach out to us, is that for women terminating a pregnancy, for an example, for a baby with complex congenital heart disease that may not be uniformly diagnosable as lethal, but is very severe, going to require multiple surgeries with a baby unlikely to have a long-term survival, families often choose to terminate the pregnancy for what they feel is the suffering, potential suffering of the child.
But this
They
bill
are
wouldn't
induced.
apply.
It wouldn't apply.
Yes,
This-
yes,
no,
it does.
no,
That's not uniformly diagnosable as lethal.
That's correct.
In
And-
line
and-
299 of the bill, one of the exceptions to this law is if the abortion is performed because the fetus has a defect that is uniformly diagnosable
Correct.
and uniformly lethal.
Do you know that it's actually quite hard to say that a birth defect is uniformly lethal, and often very hard to have a uniform diagnosis?
But if you get a second doctor to agree with you, then the bill doesn't apply.
That's not to
doesn't-
say lethal.
Well, hang-
It's not to say uniform. That says uniformly diagnosable and uniformly lethal.
Which so many things in
Many of these are
medicine
not, and
you
those women
cannot
aren't
do.
excluded. But let me get to a bigger point, which is, if this is about fetal pain, why would you exclude a baby with a lethal anomaly? If you really believe that that baby is suffering, then it's okay for that baby to suffer, but the other babies,
Now hang on.
that doesn't make sense,
I
really,
think
to me.
the actual abortion procedure that this bill is trying to prevent the pain from is the dilation and excavation. Or
Evacuation.
evacuation, thank you.
But you see, this is the
because
problem.
that's where you go in and you literally rip the baby to pieces to
So
pull it out.
this is the problem. The individuals who are making these laws don't communicate about what the medical reality of what's happening is. So the medical reality of termination of pregnancy after 20 weeks is that most women are undergoing induction of labor. So this bill is saying that I have to tell a woman undergoing a termination of pregnancy, induction of labor, that you are going to have may cause substantial pain to the baby, and now is obligating me to administer pain medications to the mother for the fetus.
So let me understand this. And by the way, if you have questions or comments, please feel free, go up to the microphone and start lining up, and I'll get to you. You can jump in the middle, and when I see you're up there, then I'll get to you, all right? So these abortions that we're talking about, Senator Henderson is saying, you know, you have to rip the baby apart. You're saying this does not occur. 99% of these abortions are.
Some women choose a dilation and extraction procedure, and let me get into that a little bit more. So women who have a dilation and extraction procedure after 20 weeks gestation, any dilation and evacuation, but any patient who's undergoing that procedure in a hospital-based setting is in an operating room. They receive deep sedation. So to undergo that surgical procedure, a degree of anesthetic is required to begin with. So that's sort of already covered. This is really more of a statement.
Why, could I ask why would somebody, what are the cases where that procedure would be used as opposed to induction of labor?
And this is another piece where this bill, I think, runs into trouble. So we're counseling a woman about her choices with a baby with a severe congenital anomaly. Let's say it's not uniformly diagnosable as lethal, because that's what the law says, okay? And it's severe, and it's probably not going to be a long-term surviving baby. And they say, I want to terminate the pregnancy. And I say, well, there are two ways to do that. There is a surgical dilation and extraction. There is
Evacuation.
See, now I'm saying it
sorry.
both ways. You can
That
just
was my
ignore
bad,
me.
sorry.
You all swirl around.
A
D&E. Can I just call it a D&E?
Please, dilation and
You have a
evacuation
D&E.
stands
It's
for
much
D&E.
better than saying going in and ripping the baby apart. I mean,
Okay, so a D&E, okay, or an induction of labor. There are pros and cons to both. The reality is that with all things being equal, a D&E is actually a little bit safer procedure, less blood loss, less risk of infection, shorter hospital stay for the patient. There are also cases wherein, actually I would say most women facing this kind of a fetal abnormality would prefer an induction because they don't like the idea of that procedure either. It's abhorrent to them. These are predominantly desired pregnancies in women who are devastated at this loss. They want an induction. But some women have had multiple prior cesareans, as an excellent example. Now that woman faces a real dilemma because an induction of labor is a much higher risk procedure for that woman. And indeed, inducing her labor increases her risk substantially of rupturing her scar and ending up with a hysterectomy. And I've personally been in these cases. It happens. It's happened within the last year. I can tell you multiple cases. If that woman has a D&E, it's safer for her, and she can go on to have future pregnancies and have a lot lower risk of serious morbidity.
my guess is, and this is just a supposition, but in Utah, and you both perform abortions in Utah, my guess is that most women would, in Utah, go for the induction of labor.
Yes, and for some women,
More than other states, I'll bet.
But is that you can only have that option,
between 20 and 22 weeks.
or if there is something wrong with the fetus.
The which? The dilation, the D&E?
No, just
The
The induction of labor.
and letting the baby just die naturally.
So
that can only occur if the baby really is going to die anyway.
Well, that
So
can
that's
occur
not an
in the
option
state
for
of
someone
Utah.
with an elective who wants an elective abortion.
Right, so in the state of Utah, you can have termination of pregnancy for fetal anomalies wherein two perinatologists certify that is a grave fetal defect before viability. It has to be uniformly diagnosable as lethal to terminate at any gestational age because it is lethal. So there are women less than 24 weeks who have a condition that is very severe, but we can't meet that very strict uniformly diagnosable as lethal. Two perinatologists, myself and somebody else, or two partners, see the patient, concur that this is likely incompatible with life, or at least very severe, and then they can legally terminate.
Let's let Dr. Torres wants to say something about this too. And you said, and I think it's based on something that you said, Senator Henderson, about a woman who elects to have an abortion. Well, I don't know, but how often does a woman just say, well, this is a perfectly healthy fetus, but I'm going to have an abortion at 21 weeks because I don't want it, and that's that?
I don't know. I can say that in my experience, it's quite uncommon, and most, as Dr. Eller said, most of these terminations that occur after 20 weeks are for the concerning anomalies that happen at the 20-week ultrasound in prenatal care, that's where we look for abnormalities. And so it would lead to reason that that's why most of these abortions that are performed are because of these lethal anomalies that are not found until 20 weeks. I have a problem with the term elective abortion, and that's sort of what prompted me to respond. All abortions are either elective or they are medically necessary. There's no difference between someone who decides to have an abortion for a lethal anomaly, as far as medically speaking, versus someone who decides to have an abortion because they don't want to be pregnant. In the end, someone who's pregnant gets to decide whether or not they continue the pregnancy, and that means either have an abortion or continue the pregnancy and give birth. So that's either elective for all,
I get
or
that. I get
yeah,
that.
or it's
Yeah.
so. And I've had a contention with everything we do in medicine is technically elective. And I would just argue that the medical indication for abortion is undesired pregnancy.
So I want to get back, I think we're getting a little bit off topic in a sense, because I think part of the problem that many of us had with this bill is that we feel it is mandating biased, unethical, untruthful counseling. And to me, it doesn't matter whether you're looking at a woman who's doing something that some others would perceive as totally elective or indicated by a fetal anomaly of any variation. We shouldn't be lying to women. Now, when we see a woman facing a medical crisis, okay, or a fetal abnormality, right, we are dealing with an incredibly vulnerable person and her partner. In that moment, we as the physician have an incredible amount of power, and with that power comes tremendous responsibility to be honest, to be unbiased, to provide the best scientific and medical evidence we can to help her make the best decision for herself, her fetus, her family. It should have nothing to do with what I would do in that situation. It's providing her with the best information I can to help her decide what she is going to do. And being honest in how I present that information is crucial. These are vulnerable women. Having someone mandate to us how we should counsel based on unscientific data is not okay. And I would argue that it's just as not okay to give false information to women seeking what others perceive as an elective abortion. It's just wrong. And that is why 23 of us across maternal fetal medicine, across the entire spectrum about our personal beliefs on abortion, our clinical practice, our religious beliefs, all felt unanimously that this was wrong. And we went to bat to say it's wrong.
Did this not, go ahead.
Well, so if I may ask a question, is it the requirement that you counsel the
Yes.
mother that there may be pain? I mean, is that the thing that bothers you the most, or is it the fact that
there's two issues here? There are two issues at play. One is the law is telling doctors what treatment to provide.
which the law does all the time in all kinds of situations, unfortunately, and I get why that's upsetting
Can you name me another example?
Obamacare, for
No.
example.
Hold
Tells
on.
us what medicine to give.
Tells
me what medicine to give for what condition.
deals
Won't
with
let you
policy.
do MRIs for certain
No, I want to know about
circumstances.
something telling me to administer a
So
specific
the
class
law
of medication.
says, doctor, you must do this in this situation. Can you tell me an example of what that is?
a physician-assisted suicide. The law says you cannot do that.
Okay, but that's
that-
not an
and that
example of what you
intervenes
must
between
do.
you
That
and
says
your
you
patient.
can't give a medicine.
Can't.
I'm asking you to
Yeah.
administer a medicine.
What about
We're not telling you which
inoculations,
medicine to administer.
You're saying I have to
vaccinations? And we've
administer
got a lot
one.
of people
What would you like me to
are
get?
trying to
Aspirin. You just
mandate
said aspirin.
that we
Trying.
require kids
Trying.
to get vaccinated.
So where's the law that says, doctor, you must do that? Where's another law that interferes with the doctor-patient
This law
relationship
does
like
not
this?
say you must
Yes, it does.
administer a specific anesthetic.
No,
Or to the
you're
mother.
telling me that I have
It's to
to.
the-
It just
It's
says-
to the fetus.
It says you can
How do I
you
get
can
to the
choose
fetus
anyone you
without
want.
getting to the
Well,
mother?
if this is the
You
case.
don't have to put the mother under general anesthesia to get to
How?
the fetus.
Well, then how would I
How
do
do
that?
they do other fetal procedures? They do through the amniotic fluid, through an intramuscular injection
you
into
give
the
a-
fetus,
So
through the
that,
umbilical
I have
cord.
to stick a needle through the maternal abdominal wall into the uterine cavity,
You can't
through
get
the
to the
wall.
fetus without going through the
Yeah.
woman.
I understand that, but doesn't
Okay.
mean that you have to put the woman under, put her to sleep in
But
order
this is
to
my
do
question. This is my question, and I've talked to the Attorney General's office, and I've talked to several people under that umbrella. What do you want me to do? What do you want me to do? Tell me how to give a fetus
We
anesthesia.
want you to use your medical experience and make.
This
a
is
I'm
not
trying
a
to do
medical
that.
practice.
You don't
No.
want that.
No, we just
This
heard.
is not a
No,
medical
hang on, hang
practice.
on.
We
for a
just
second.
heard that aspirin permeates the
Ibuprofen,
fluid.
but sure.
Ibuprofen. So that's one of your options. Because
So then the
Bill,
point-
this is not about whether they need to give the woman ibuprofen. This is about the warning. They don't want to tell a woman that the fetus may feel pain. That's where the objection to this law comes from. And it's not about, they're creating all of these barriers when she just admitted they can give them ibuprofen.
Well, that
Senator
may be
Weiler's
the
right.
solution to this whole thing. Why don't you just say, here, have a couple aspirin, and then let's go on, a couple of ibuprofen, and let's go on with what we're...
Because I don't want to lie to my patients.
It's not a lie.
Yes,
It's
it is.
No, it's not a lie. I just read you the data. It's not a lie, and you
Well,
can't
here's
tell
the
me.
data.
You cannot tell me it's not true.
I can't prove a negative. I can't
It's
tell you
may.
that unicorns
That's why
don't
we
exist.
changed the word from will to may.
If you
May is
really-
not a lie.
If you really believe
Please
that
take
the
this
fetus...
information
Well,
that
if-
medical doctors
now,
use.
Hang on, let me ask this.
And this is for
do you have
Bill.
a question? You, sir? All right.
So
You're
that,
looking for an opening.
that
huh?
has information that the medical practice of obstetrics and gynecology uses in order to counsel patients and provide evidence-based health care. Your citations, while may be accurate, that is not the evidence that we actually use to practice medicine or counsel patients.
But that's different than a lie. You're saying a lie, and that's a lie. It's not a lie.
If I say that they may feel pain, I feel, in my medical opinion, that that's a lie.
But I'm a lawyer, and I'm telling you it's not a lie.
I'm a
Well, that
doctor, and
doesn't
I'm telling
come
you it
with
is.
it, sir.
You will not be convicted of perjury for that.
You know what?
So
Can
what-
you tell me what I will be convicted for when I'm arrested because somebody says I didn't give anesthesia to the
Okay.
fetus?
Well, give them the aspirin, and you'll be fine.
So are you suggesting that
Promise?
all women in labor...
Okay, great.
Are you
That's
suggesting that
kind of
all
what I-
women in labor should be administered anesthetic for the fetus? Because,
No.
again, that's what
No.
I'm talking about.
You perform. I mean,
Your
doctors,
law says termination of pregnancy after 20 weeks.
doctors perform surgery in vitro, and they give.
She does.
Okay, and you give the fetus
No, I don't.
anesthetic already.
No, she doesn't.
Well, no, you do.
I give
because
paralytics sometimes.
when you put the mother, when you give the mother anesthetic, you know that also affects the fetus.
I don't give the mother anesthetic to do an intrauterine transfusion. There's no
If
anesthetic.
you
the
not know
mother
that?
asks for it, you refuse.
I would give her sedation if she wants it, but a lot of
Okay.
women don't.
And the law. And
But it
you've
has
been-
nothing to do with the fetus.
You've both been practicing in Utah. The law for years has said the mother has the option.
We're offered, always.
Yeah,
Patients,
yeah.
you know, it turns out women are pretty thoughtful about
Yeah.
these things, and they often will ask you, do you think that the fetus feels pain? And we have a meaningful discussion about how, first of all, you can
And
never
do you
know.
share all the facts that I
I
just read
do,
off?
I do. I say, you know, there is a group of people that believes that they do. Based on neuroanatomy and based on our understanding of physiology, we don't think so, but no one will ever know for sure. And if it would make you feel better to administer, to have deep sedation, know that that medication is going to go to your fetus. That's what we say.
we do say that to people.
So,
We are thoughtful people, you
is
know.
this going to be are they going to be totally fine if they just say, look, I'd like you to take a couple of ibuprofen just in case, and then let's go on with these
No,
this
they
procedure?
also, Bill, and this is what they're objecting to, they also have to say after 20 weeks that now this is only for healthy babies, healthy moms, elective abortions. After 20 weeks, we're talking about 17 abortions a year.
hardly
They
ever
have to
gonna
say
happen.
that the fetus may feel pain, and that's what they're objecting to.
One
it's not the
fetus-
aspirin, it's the may feel pain.
Why don't you mind that a baby with a congenital abnormality feel pain? If you truly believe this in your heart, and if you truly believe that, just let me finish my
Why
question.
are you picking on me for making a concession to the Utah Medical Association? Because that's what they asked us for.
But it shows that that's not the principle of this bill. This isn't about protecting babies
to
from
make that
pain.
concession, and we said
This
yes.
is about creeping up on abortion. This is about
Well,
coercion
let's-
and shame.
let's,
This is not about fetal pain.
I do.
You have questions, Bill?
I do have that question. The question is, and it looms, and it's just there, is that you're both against abortion.
Absolutely.
Can you honestly say that this bill, Senate Bill 234, was done, can you honestly say, was passed to protect a woman's health, to ensure the comfort or lack of pain for a fetus, or is it just to discourage women from going through with abortions?
I think that ultimately, probably a little bit of all of that, right? I am very pro-life. I'm unapologetically pro-life. I do believe that there are instances where, for the health and life of the mother, or rape and incest. I mean, I'm not a never person, but I am very much pro-life and believe that if abortion happens, it has to be in very, very rare, just in these very difficult circumstances, not just because a baby is not wanted. But I do believe that this bill is the reason that there is so much outcry, which surprises me. I mean, it really does surprise me, because just the logical part of me thinks, well, if it's possible for a fetus to feel pain, why can't we give the fetus some anesthesia before the fetus is dismembered? I mean,
That's not what the bill asks for. It says termination after 20 weeks.
Right.
It says nothing about D&E.
It says abortion.
It says
it's abortion.
abortion can be performed by D&E or by induction of labor.
Well, and maybe that's
Most
something
cases
that we
after
needed
20 weeks are induction of labor.
Maybe this is why more women need to be in the legislature, so that we
So let me
understand some of these terms
the
are understood a little bit more. But let me make my point. The reason I decided that there's so much outcry is not because it's not so much because it disrupts any kind of relationship between a patient and her doctor, more than it disrupts the narrative that an abortion isn't just about the woman. It's not only about the woman, and this admitting and acknowledging that an unborn child may feel pain disrupts the narrative that an abortion is only about the woman.
Well, that is where you will get the disconnect, isn't it? Because doctors who perform abortions, I think, would tell you that the woman is their patient, is their primary.
Right, and who's there to advocate for the unborn child?
But wait a second, I want to go back to something else you said, which is this is why we need more women to understand these things. I want to say something. My partner, Dr. Sean Espelin, is an incredible human being, first of all, okay? Above all things. But he is also a nationally known researcher in perinatology. He is a pillar in his community. He is a high-level leader in the local church. He went to the legislature. He asked to talk to Senator Bramble, who told him he was not interested in understanding the information, right? He said, Dr. Espelin said to Senator Bramble, "Sir, I am the expert in this. Why won't you ask me about it?" And he said to him, "You know, we are the experts in everything in politics." And do you know what Dr. Espelin came home and said in total disgust at this encounter that he had just had? He said, "You know, it seems to me that public servants ought to be humble enough to know when they are not the expert, intelligent enough to seek out expertise, and courageous enough to stand up and say what's true."
We've got a question here. Let's get to this
Bill,
gentleman.
as a lawyer, I have to point out that was double hearsay. Thanks.
I don't even know what that is, but yes. What's your name, sir?
My name's Dave.
Yeah.
I'm curious if the folks in Congress have a plan to introduce a fetal pain bill for normal live births next year.
Congress passed a partial birth abortion ban. And
That's not the
To normal
question.
live births was the question.
Term birth.
I'm addressing your question because I don't have a crystal ball, but they addressed a partial birth abortion ban in 2006. Last year, the House passed House Resolution 36 that they took weeks of testimony, and they used the will language that we amended down to may, but the Senate didn't take that up. So even the may language is less than what the House of Representatives has already passed. But I can't tell you what a future Congress.
We're talking about
may
fetal
do.
pain. That was
I
the
can't
question.
tell you
If
what
you
a
believe in
future
fetal
Congress may
pain,
do.
do you worry that when we do a forceps delivery, which involves putting, metal salad tongs and pulling and get bruising and, that we ought to be anesthetizing those fetuses?
The difference is the forceps are trying to help the baby come out, whereas in a D&E, you're trying to crush the skull.
That's
And
a
so-
baby that's going to suffer pain
Well,
a lot
there's still-
longer than a
but
baby that's
that's
going
a
to
huge
die.
difference.
If you're talking about
Trying to
pain,
crush the skull and dismember the baby is different
that's
than
over
trying to help
quickly
it out.
compared to a forceps assisted delivery. I don't understand. If it's fetal pain you're interested in, then let's talk about
They're
fetal
both
pain.
those. I
But
mean,
it's
she's
not
well,
about
she's
fetal
asking
pain.
you.
Well,
Is
you
they're
can
both
give
fetal
you can
pain?
Are
give
you
them
worried
under the
about
aspirin
pain?
then as well. I mean, you're the
Then-
doctor.
Do
You're
you
the
really
doctor.
think that an
That's right.
aspirin would cover
We
this
are the
dismemberment
doctors.
that you just talked about?
No, what I'm
Well, then-
saying is this, I believe, is all about the warning that the fetus may feel pain. I think everything else is smoke and mirrors.
If you're truly concerned about fetal pain, then why are you not addressing babies that are born with clavicular fractures and all kinds of other birth injuries? Don't they feel pain too? Should we put them all under a general anesthetic?
circumcision?
Let's ask this. I mean, I think you're kind of being disingenuous when you say all you're concerned about is the fetal pain. I think really what this is an effort just to stop abortion, pretty much.
And I'm not going to deny that, Bill. In 1996, the Utah legislature passed a bill that said there could be no abortions in Utah after 20 weeks. We were overruled by the 10th Circuit Court and that was sustained by the U.S. Supreme Court. As a lawyer, I believe politics was absolutely involved in the Roe versus Wade decision. There is the word privacy, and the justice that penned that decision said that there was a penumbra, whatever that word means, of privacy that he's inferring in the Constitution. I don't believe that Roe versus Wade is an accurate description and interpretation of the U.S. Constitution, but I do believe in the rule of law, so that we have to follow that. So the state of Utah came and said, we don't want any abortions after 20 weeks. The federal court said you can't do that. And so now we're pushing a little bit further to see if we can do this. There's absolutely politics involved in Roe versus Wade and in what the Utah legislature has done. There is a states' rights component. There is a compelling interest component. And as Deidre mentioned, nobody's looking out for the baby. In the law, if there's a child, no, you're trying to kill the baby. You're not trying to protect the baby.
Sir,
No.
that is insulting.
That's abortion.
That is
No,
inappropriate.
in an abortion,
What I do
your
every day-
objective is to kill the baby.
Hey, that's being a little
That's
too
atrocious.
inflammatory.
No, that's
talk.
what an abortion does,
Because
Bill.
these
An
people
abortion
are-
ends the life
These
of an
people-
unborn human being.
But these-
that is by definition what an
that's-
abortion is.
that's-
And don't
but-
take
hang on.
umbrage when I point out the obvious.
No,
Sir.
hang on. I'm just all I'm saying here is that these women work in family planning.
That's fine.
And abortion is
But I'm
probably
talking-
a small part
An elective
of what
abortion.
they do on a daily basis.
An elective abortion is a decision to murder an unborn human being. Under our federal law, if I destroy an unborn eagle in an egg, I can be convicted of a felony. If I murder a woman who's pregnant, I can be convicted of 2 deaths. But we allow, because of Roe versus Wade, we allow doctors to murder unborn children. But I'm not going to dress that up and
Get
make it
into that
fancy.
argument.
Let's diffuse this for a second and go to a question, or maybe not diffuse it. Uh-oh.
Do you want to not jump in right there? Because I have one other thing.
Seriously, I kind of want that to go on because I'm fascinated with the narrative and the choice of words that you're using, senators, to describe what these medical professionals do for a living. So actually, if I can cede my time for a moment, if you can explain why you're talking about people who went to school for sometimes over a decade and practice this medicine. Can you explain to me why you're talking about them the way that you would not allow people to talk about yourself?
I'm sorry, but we can make all these fancy words and call it a D&E, but these doctors, and there's many doctors who refuse for their own beliefs and their own morals to perform abortions, but we can use these fancy terms like D&E, which really mean you're dismembering an unborn human being. And I'm sorry if I'm not sugarcoating that, and if you find that offensive, but that's what's happening because of Roe versus Wade.
Can you correct that with the legal language, that you corrected them when they were using medical terminology, and then you corrected them?
I don't understand your question.
You've corrected them 2 or 3 times already this evening using I'm sorry, as a lawyer, I have to correct you with the legal term.
Let's not get
But I have an actual different question. It will possibly diffuse that. And it's just because I'm new to the political process, and I was up at the legislative session watching you do your jobs and your elected jobs. And I'm just wondering, given the fact that we have noted that there are a couple different facts that some of the legislators didn't know about, and maybe we should have had more women in the legislature, and I know that there's a lot of people working for that. Why was the bill introduced in the Business and Labor Committee as opposed to a Health and Human Services or some sort of medical professionals who could have been in that committee? Can you explain that as a novice to the political process?
As vice chair of the Rules Committee, why don't you take that one?
Because the sponsor of the bill is the chairman of the Business and Labor Committee, and at the end of the session, all of the committees basically divide the remaining bills so that they can all get heard. And we did have, despite the fact that it was heard in Business and Labor instead of Health and Human Services, we had a number of doctors come both in the House, and that was in the Senate. It was heard in Health and Human Services in the House. A number of doctors came and testified regardless of what room the committee's in. So
And if I could just add, just in the Senate, there's so few of us and so many committees that sometimes we have a hard time even keeping a quorum because we're off in other committees trying to get our bills heard. And so oftentimes, if we're chairing a committee, we have our bills heard
So
in that
there's
committee.
situations where like tax laws are decided by the Health and Human Services Committee?
There could be.
There could be.
But-
I'm chair of Rev and Tax, and we hear all kinds of interesting things in our committee sometimes.
Duly noted, thanks.
Clarify.
Thank you.
Clarify, and then I want to say something.
Can I just,
Yeah, go ahead.
I just have to address what Senator Weiler said about why we oppose the bill.
And
Okay.
I would never presume to know excuse me.
I'm talking about the medical
Senator
community as a
Weiler,
whole.
could I speak, please?
Okay.
What I'm saying is that we oppose the bill, speaking for the medical community that I've actually worked with for a few years here. We oppose the bill because this is an interference, not only in good evidence-based medicine, but also in the doctor-patient relationship. This is not a request. This law does not tell us to provide evidence-based medicine. This law tells us to experiment on pregnant people because this is not standard of care. She knows that's exactly what it is not standard of care. You are also requiring me to break the 4 principal medical ethics, namely autonomy, justice, beneficence, and non-maleficence. I do not want to lie to my patients. I don't even want to give them an inkling of lying to my patients. But the point of this is, I'm opposed to practicing bad medicine. That's what this law is making me do.
And I'm opposed to abortion.
You know
And that's
what?
what the
You
Supreme
don't
Court
get
is
to
making
have an
us do.
opinion on it.
And
though.
that's really what this
That's the
gets,
thing.
that's
Well-
what really this gets down to. This bill is kind of a,
It's healthcare.
it's kind of a sham, really.
It's not a
Oh, I
sham.
don't think
It's
so
a
at all.
message bill.
It's a message bill.
Who
So
is,
it's
let
a
me,
message
let me
bill.
just ask
Can I-
let me just ask this, and I don't know if any one of you can answer this. Do you think that this bill is ever going to be, that this law is ever really going to be enforced? Are you going to, you're just going to continue to do what you do?
I'm
I
gonna
want to know
practice
what
good
I do with
medicine.
the woman who refuses. This is what we all want to know. When we have a patient who's being induced, and we say we have to administer some degree of anesthetic to the baby, and they say no, what do I do?
No, you don't have to administer it to the baby. You can
Yes,
administer it
I
to the
do.
mother.
Yeah,
She
you
says no.
can
I
administer-
Then
can't
you
force
tell her you
medication
can't
on a
perform the
patient.
abortion.
But
What if
she
the
can't
woman?
be induced
What if the
based-
woman came in after 21
So,
weeks and wanted an abortion? You'd have
Just
to
a
say
moment.
no.
It is
the
not,
law doesn't allow that.
Just a moment.
This
It
is about
not
performing abortions, not inductions. It's
abortion.
abortions.
An induction abortion is an abortion.
It's the
This is
same.
what you guys don't understand. An abortion
So,
by
one of the
induction
things-
is an
one of the
abortion.
things
We
that's
do
not
medical induction in the first trimester too without a suction DNC. You give medication, it induces contractions, painful cramping, and bleeding, and that is an abortion. An abortion does not require a surgical procedure. This is the disconnect. People don't understand what we're doing. So if I am
I can
inducing
tell
a
you
woman,
that the intention behind the bill
well,
is
that
to
may
give
be, but no one
anesthesia
asked for
to-
the right information. Humble, right?
Let's
So-
go to another
No, hang
question.
on, can I say one thing
Okay.
I needed to say? So I hear a lot about wanting to reduce abortion, and I think that's something we should all be able to agree about, right? That we would like them to be really rare, if we can. I know you don't like that. I want to say that.
Okay.
But, so let's talk about reducing unintended pregnancies. Instead of vilifying organizations like Planned Parenthood, right? And let's talk about who does the most in the state of Utah to reduce unplanned pregnancies and to therefore reduce abortion in the state of Utah. It turns out it's Planned Parenthood.
Right.
Over 96, let me finish please, over 96% of what Planned Parenthood does has nothing to do with abortion. Patients pay for abortion out of pocket. To inhibit and block, as Governor Herbert did, federal funding through the Department of Health to Planned Parenthood reduces contraceptive services and education services and STD screenings. They provided 147,000 contraceptives to patients last year. They served over 46,000 women, and less than 4% of what they did had anything to do with abortion. Blocking federal funding blocks contraception, it blocks education, and it has no impact whatsoever on abortion services, which are all paid for out of pocket.
Increases
So if you
in
want to
fertility.
put your money where your mouth is, you will support reducing unintended pregnancy and support contraception and support educating our kids and support organizations like Planned Parenthood. It's really backward thinking.
Would you like to respond to that at all, or
Senator Weiler, do you need a minute?
you want to respond to that? I think Todd is playing Angry Birds.
No, I'm not. I actually.
I need Angry Birds.
I actually pulled up Section 76-7-301, subsection 1A
Which
of the
is under
Utah
what
Code,
chapter?
of the Utah Code, which defines what abortion means.
What does it
Just
mean? I'd
define-
love to know.
Can you define with a chapter? Can you just state the chapter for the audience so that they know?
Title 76, Chapter 7,
What's
Section 301.
what is the name
of the
of it?
Utah Code annotated.
It's crimes against
The family.
crimes
it's
against the family.
offenses against the family.
Offenses.
It's under criminal code.
Yes.
So this
yeah.
medical procedure is under criminal code. Okay,
Well,
continue.
that's
Thank
where
you.
that's where we've chosen to house
It
the
is,
abortion
I
laws.
know, I understand
But it still defines abortion there. It says what it is
That's
and what it
fine.
isn't. And it's a rather long definition. It includes the intentional killing or attempted killing of a live unborn child.
Can you
That's what-
cite the medical reference that's used to define
This,
abortion
this
there?
is the law.
I'm sorry,
Just like
say-
Roe versus Wade is the law.
Say it again.
So-
Okay, Roe versus Wade doesn't say what
The
abortion is.
definition of abortion under Utah law includes the intentional killing or attempted killing of a live unborn child through a medical procedure.
So inducing a baby that's pre-viable ends that baby's life. So that is an abortion.
I'm not disagreeing with
And
that.
when we consent a woman, when we discuss it, we have a 3-day consent. We go through this whole process because induced labor for a pre-viable baby with birth defects.
We're talking
is an
about
abortion.
1 week between 20 weeks and 21 weeks. That's all we're
We
talking
could
we're
be
about.
not.
talking about one patient.
We're talking
It
about
doesn't
any
matter.
termination after
Let's,
20 weeks. And we're talking about lying.
No, no,
We're not
this-
talking about
this bill,
anything but
this bill
dishonest
that's been noticed for
information.
the thing tonight, this event is talking about 1 week between 20 weeks and 21
Doesn't
weeks.
matter.
Let's
it's
go to
not.
this,
So
yes. What's your
actually,
name?
that fits really well into where I would like to go. I would like to introduce you to the person who that affects between 20 and 21 weeks. We're talking about, what did we say, 17 pregnancies a year?
Abortions, yeah.
17 pregnancies, most of which were wanted babies, desperately wanted babies with horrible defects that are going to cause them pain. These families are already in pain. They're already in pain. And you are adding an extra level of pain that is basically lying to these patients because you think that you're saving them from pain that they're already in. You're not protecting anybody's unwanted pregnancy. You're adding pain to families that are already in pain. That's who this bill is affecting. It's not affecting the 16-year-old who had an unplanned pregnancy. These are desperately wanted pregnancies. And these women and these families are already going through the worst moments of their life. And they are with healthcare professionals who are trying to guide them through that. And the induction is the only way that they can hold their baby and take care of their baby. And this is interfering with that one breath that this fetus could have. One breath. And this is making providers have to sedate a baby who may only get one breath with their parents.
This makes me ask the question, I think, then, why, if this is such a rare instance of 17 a year, and it is this painful for these families, and you probably have dealt with these families and know what they're going through as medical professionals, why go after that? Why go after that in particular? Why not just do what you really want to do, and that is try to ban all abortions?
We did that. It didn't work.
Can I address that?
Then what does that tell you?
It tells us that there's still some space to move in, but go ahead.
No.
Deidre.
First of all, where did she go? It sounds like you've had some traumatic experiences, and I am very sorry for your pain. And we have not been trying to cause additional pain to people. I lost 2 babies as well, and I know how incredibly, even at an early gestational age, how incredibly painful it is to lose a baby and to lose a pregnancy. So whatever it is that you're feeling, I am sorry for that pain that you're in, and in no way want to compound that. I think the intention here is certainly the intention, my understanding with this bill, was to not interfere with those situations, but only with the really violent procedure that the D and E, I guess we agreed to call it, which is a much more violent, it's not a natural giving birth.
Have you seen a C-section?
Yeah, I've had a C-section.
Okay, so that's not a natural birth either.
No, but we're talking about these induction, or all of the abortions as though they're a natural process, and they're not. They're very violent on the fetus. Some of them are, and those are the ones that are being targeted. And I believe the bill sponsor has some sort of personal experience that has prompted him to want to run legislation like this. He felt very strongly about
Could be
this.
Senator Bramble.
We all have our experiences. We all have the things that help shape who we are and what we think and what we feel. And nobody's trying to compound pain for anyone in these difficult situations. But we do see a vulnerability with some of these procedures and the potential that there could be pain involved for that baby. That, anyway, is where I'm coming from with this bill. Certainly not trying to compound anybody else's pain, but to solve what looks to me like a loophole. And I think that the problem, as I stated earlier, is not so much with the kind of the anxiety among some people with this bill, it's not so much the disruption of the healthcare practitioner and their patient, but the disruption of the narrative. And the narrative has always been, and I guess it's a very important narrative for pro-choice people, that this is only about the woman and that it's only a non-viable lump of tissue. And that is the narrative that recognizing that a fetus may feel pain disrupts.
Could I get you to respond to that,
Yes.
Dr. Torres, and particularly this idea that you're only concerned about the woman and you don't care anything for this lump of tissue?
Now, I never
No, that's
accused
fine.
individuals
No, of course
here
not.
sitting there.
No.
But in general.
Here's a few points. Intentions with the bill are not the same as consequences. And you had multiple physicians come to the hearings and tell you what the consequences would be, which is exactly what that woman stated: increased pain and suffering of the patients involved. Excuse me, let me finish. Then you have the narrative, as you say. I don't get to decide what a pregnancy is to somebody. No one does, except that person who's pregnant. If someone comes to me and says, I'm pregnant and I don't want to be, I don't have the luxury of telling that person what I think. My job is to provide all of the information about all of the options, including all of the risks and benefits of each. That is what informed consent is. That person then decides if they want to undergo the risks of pregnancy, which are way higher than the risks of abortion. And yes, the narrative is about the person who's pregnant, because you know who's undergoing risks of pregnancy? The one who's pregnant. You know who's risking their lives for pregnancy? The one who's pregnant. The fact that we would ever dare belittle anyone who's pregnant into something that's just something they do without respecting the amazing gift that they give and the sacrifices, not only physiologic, but also in life, that they give to continue a pregnancy and give birth. We treat that as if it's just something that, people just do. It is not revered as it should be. And so, yeah, the narrative is, it is about the person who's pregnant. Yeah, it is, because they're the ones at risk. They're the ones risking their lives. And whether you see a pregnancy as a piece of tissue, as a fetus, as an unborn child, that doesn't eliminate the placenta, the umbilical cord, and the physiology that has changed in the pregnant person in order to continue that pregnancy.
This bill, very short, was aimed at elective abortions for healthy mothers and healthy babies. And to that woman who's obviously been suffering, I'm sorry, but this bill does have an opt-out for a defective fetus.
No, it does
And the
not.
bill does not apply, and we've already read that language.
That language says uniformly diagnosable and uniformly lethal, number
Which
one.
I'm sure
Number
is not
two,
true.
here's a question for you. When is it okay to lie to someone to make them do what you want?
Let's go to this question.
I didn't have an answer yet.
What is your name, ma'am, and what's your question?
We should get an answer.
My
to
name
that,
is
though.
Linda, and I really wish I would have asked this question sooner because it really doesn't fit this segment. But I found the discussion early on about pain and the perception of pain and how we can't judge that based on just the medical knowledge of what happens in the brain. And I'm not going to use all the right words because I'm a business developer, not a doctor. But, so my question, you brought up specifically someone that has a paraplegic, right, that doesn't perceive pain. And this, given the heated discussion we're having right now, I do not mean this to be a kind of a try to get you question or anything like that. I'm seriously curious. So if you have a patient that is a paraplegic or a quadriplegic and they need a medical procedure that requires cutting or requires some sort of invasion, do you anesthetize that person?
It's actually a great question. So it turns out that having an epidural type of anesthesia, like you would for any laboring patient, is actually critical for those women because all those physiologic responses to noxious stimuli can be very dangerous for them. And so it's actually really important to regulate all those things that change your pulse and change your blood pressure and change your cortisol levels and all kinds of things. So absolutely.
Okay. So full disclosure, I'm pro-life. I believe that if a woman is raped or a victim of incest, absolutely, they should not be forced to carry that burden if it's something that they simply can't get past. I completely believe that. My mother, when she was 18, gave up a child for adoption. And my heart just hurts for people that have to make these difficult decisions. It does. So when I look at this law and I see the opposition to it, from my perspective, why wouldn't we try to make it as less traumatic as possible on all parties involved, to include the baby? Why would we fight against that? That's the part I don't understand from the opposition. I understand what you're saying about the woman's choice. I get that.
I think Dr. Eller addressed that earlier.
Well, I have something else to say about it.
But go ahead.
Yeah, no, I think it's a really legitimate question. Okay, and I think that when we counsel patients, we certainly counsel about the gray area. And we don't need this law to tell us that we don't know for sure, right? And so we do offer those things and we talk about things and we always have. But it's between us and our patients based on our best medical understanding of the situation, not on someone legislating how we counsel. That's number one. Number two, I really believe that all of this talk and new movement across the country about fetal pain really has very little to do with fetal pain and has much more to do with the agenda about trying to eliminate abortion. So the sort of anti-choice movement tried religion as a reason to justify outlawing abortion for everyone. And by the way, when we say being about choice, we're not talking about choosing abortion. We're talking about the right to choose. And I have a lot of patients who don't choose that, but that's their choice, okay? So when we talk about the anti-choice movement, all right, it didn't work to say on religious grounds, we're going to convince everybody not to have abortions and ban it. It didn't work to say, human life begins at conception, so everybody should be against abortion. That didn't work. It turned out that maybe a third or so of the country, 40%, agreed that we don't like abortion after 13 weeks or so. That really wasn't enough to get a majority. About half said, well, we don't really think abortion's probably a good idea after 16 weeks. Maybe 2/3 after 20 weeks, which suddenly became a magical number. And then they said, well, what else could we use? How could we appeal to people to say that abortion is abhorrent and we shouldn't do it? It turned out that when they asked people and polled people, that they asked people, if you knew the point at which a baby felt pain, would that be the point at which you shouldn't have an abortion anymore? And people said, yeah, that makes sense, because as human beings, we would it's logical, right? The point at which in pregnancy the fetus has the capacity to feel pain, pretty much people felt like we shouldn't do abortions after that. So then, boom, we have our majority to try to convince the American people that abortion should be illegal. Now we just have to back up the anatomic scientific data about when the fetus feels pain, and we've got our in. So this is all about trying to overturn Roe v. Wade. This is all about ending a woman's right to abortion. Sure. It has nothing to do truly with whether you're concerned about the experience of fetal pain in an abortion, in a term labor, in a forceps delivery, in a skull fracture incurred at the time of a cesarean. It has nothing to do with that.
Would you disagree with that, Todd?
Well, no, I've admitted twice and I'll admit a third time there is certainly a political element. But let's be honest, if you read and understand Roe versus Wade, what it says is that a woman has the right to an abortion before viability. And that was 40 years ago. Our technology is substantially better now. So that is a moving target. And we know that up to 5% of fetuses who are delivered at 20 weeks will survive. I've read the medical.
You've not read the proper medical journals.
3 to 5%.
You have not read the proper medical journals.
Now, a lot of them will not be quote-unquote normal. But up to 5% will live, and that is medical journal verified.
So sadly,
Not the correct one.
Sadly, unfortunately, as a maternal fetal provider, I face these situations very regularly. These very early preterm labor, trying to help patients decide in what we call the periviable window, which is typically 23 to 25 weeks, whether they want intervention on fetal behalf or comfort care measures. That is, they're in preterm labor, they're going to have the baby no matter what we try to do. We're trying everything we can to keep the baby inside, but the baby's born. And we have to counsel them about whether they want full intervention on fetal behalf or comfort care. Our nurseries, neither the NICU at Intermountain, at LDS, at the U, when we convene and talk as a multidisciplinary group, and one of these women comes in and is going to deliver, I have never seen them aggressively intervene and resuscitate a baby at less than 23 weeks and 0 days. We don't offer classical cesarean and all of these things. I don't know where these people come up with these numbers. They're either, sometimes it's incorrect gestational dating, sometimes it's fetal size and not gestational age, but 23 weeks and 0 days is the bare minimum that we use to do, sudden aggressive intervention on fetal behalf.
Let's get to this question, because we're actually over time. But what's your name, sir, and what's your question?
My name is Mark Barnes. I would like these senators to understand that what a family goes through in this kind of situation. This is exactly the situation that my family was in. 20 weeks, we found out that my wife that was carrying a baby that had spina bifida, and nobody could tell us whether it was fatal or not. And we were sitting there totally, who knows, it could be low down and maybe the baby would live. It could be high up and maybe the baby wouldn't, and it would go through all kinds of operations and have all these possible terrible things happen. In all this uncertainty, we had to make this decision. We had to make it in a matter of a few days. And it was a horrendous, horrendous experience. And to trivialize it and act as if people just do it for some unknown reason is just ridiculous. And to think that the legislature has any role in imposing themselves into the picture and getting between the doctor and the patient, to me, seems just ridiculous. So I guess my question is, as senators, why do you think you have any role in putting yourself between a family like that and who are trying to face these difficult situations and the doctors who are trying to give them advice?
Again, I'm just going to repeat myself. Roe versus Wade is a law. Abortion was illegal in Utah until Roe versus Wade changed that. And then we passed a law in 1995 that was overruled in 1996 saying you could not do abortions after 20 weeks. And technology has improved. Every statistic I've given is based up, and the one that I gave that was disputed was the May 7th, 2015 edition of the New England Journal of Medicine. And so we make laws, just like we make laws that say you can't kill baby eagles if they're still in the eggs. We make laws. That's what governments do.
Let me just, but you didn't address the question really, and the question was, why do you think that the legislature has the right to intervene in that particular situation?
Because in the law, if there's a dispute going on involving children, you usually have a lawyer for each parent, a lawyer for the state, and we appoint something called a guardian ad litem, their job is to only look out for the child. And nobody's doing that, I believe. These doctors, their patient is the mother. And the legislature came in and said, there's also an unborn human being here, and we're going to look out for them. And I think that is absolutely within the proper role of government.
Do you know why that is? Do you know why we treat pregnant people as our patients and we do for them what they ask us to do for them?
They're the ones paying you?
No, sir, that is not why.
I mean, really?
Why do you need to make remarks like that?
You asked me a question.
I wasn't done, actually.
Okay.
Do you feel
We're paying
that
you,
you can actually tell someone, for example, can you tell Bill whether or not he should have a vaccine?
A vaccine?
Yeah. Do you get to tell him whether or not he can have a vaccine?
I would not do that, no.
Why can you tell a pregnant person whether or not they get anesthesia?
Because based on the science that we've had available, and based on your own admission that you can't tell us that the fetus feels pain
Because
or
you
not
can't
20
prove a
weeks,
negative. I can't tell you
then
unicorns don't exist
then
either.
I've explained my vote twice. You
All
want me to
right,
do it a third time?
we've
No, I
gone
don't. I want
over
you to be
it.
respectful to me.
But, and I also, I need to speak for myself for a minute, because when you say nobody speaks for the fetus, I frankly spend almost every day that I'm at work fighting to try to help keep babies healthy when they're inside. Doing fetal monitoring, doing invasive procedures to save babies that would otherwise die, trying to help figure out the optimal timing of delivery to save a baby's life. And I find it personally extremely insulting that you would assume that I'm a barbarian
No,
who
I don't assume that.
just does D&E procedures.
Let me
called
just
us
ask a question,
murderers.
Bill. I was asked a question.
You called us
It's
murderers.
offensive.
If a woman comes to you at 20 weeks and says, I've changed my mind, I want to have an abortion, and I want to do a D&E, would you do that for her?
Well, I can't do that in my practice setting.
I
So
would.
that's not an option for me.
That's.
And do you know why?
Thank you.
Do
Thank
you know
you.
why?
That's my point.
No, excuse me. There's more to that story.
I broke
You
up with my
understand-
boyfriend. I
do you-
broke up with my
no.
boyfriend. I don't want his baby.
Here's the extent of the story. I'm pregnant, and I don't want to be. That's it. It doesn't matter beyond
And
that.
who's
No.
and in
I'm the one
in
providing
that
the service.
scenario, who is looking out for the unborn fetus? It's not
the
you.
one who's pregnant.
It's not you.
The one who's pregnant is making the decisions about that unborn
That's
fetus.
my point exactly. And the legislature stepped in and said that
All right.
unborn fetus should
Let's
not
go
have
to this
feel pain.
question right here. What's your name, sir?
Dave,
Go ahead.
so I have a question for the senator. You've talked about these 30 physicians that you talked to before you voted on
I
this law.
communicated with. Most of them were via email.
So that seems like a rather small amount for how many physicians there are. What was the selection process there? How did you determine who you were going to talk with? It seems to me like you've avoided any expertise that's in conflict with what you wanted to push through. It doesn't seem like you've seeked out the information that was needed to make a decision like this.
Okay. I don't know what the magic number for you would have been, but we dealt with 900 bills in 45 days, and I took more care and did more research on this bill than way more than the average bill. We have a very short legislative session, and every doctor that emailed me and the doctors I knew and the doctors in the legislature, I felt like I went to a fairly extraordinary effort. And I also reviewed a lot of the medical research that I cited at the beginning tonight. And so you may disagree with my decision, and I respect that. But as both Senator Henderson and I have said, no doctor can tell us that the fetus won't feel pain, and we are willing to take that chance that they can and try to alleviate that pain for an elective abortion after 20 weeks for a healthy mother and a healthy baby. That's what this bill was designed to apply to.
We're way over time
It just
here.
seems that you've gone out of your way to avoid hearing anything that you don't want to hear. So.
And you're judging me, and you
Well,
can do that, but that's just not true.
You're judging people as well.
Let's
today.
get this question in here, and then
Thanks so much for the time.
Yeah.
I'm an aspiring politician, also a medical student.
that doesn't go
That's
together.
It's really busy.
Good luck with that.
But I appreciate all of you guys being here. And my question is, what's next? So what's coming next down the pipeline for fetal anesthesia bill, either on the pro side or on the anti side?
I don't know. I mean, I didn't run this bill. I don't know. We have 104 legislators.
You
We have
voted
several
for
that aren't
this
even
bill.
elected yet, and they can run any bill they want, and we can vote it up or down. So I don't know.
Again, I just was, would you, I suspect that this bill is never, that this law is never going to be used.
I would really like to not get arrested for providing health care.
I don't think, I don't,
Can
What
I
do
can
we
I
do
do
with
that?
the woman who declines
Can I do? Is that
medication
possible?
beyond the standard of
Can I
care?
answer?
Yes,
Yeah.
please.
What we've learned tonight is if you give the mother an aspirin, and if you tell her the fetus may feel pain, you will never get arrested
I
under
give
this law.
That's so disingenuous.
And there will be no police officers standing in your room when you're consulting with the mothers. So
So you can't enforce the law.
The
So you've
law-
passed a law that
the law
affects
would
people's
only-
lives.
is it,
that is
the law would
unenforceable.
only be enforced, let me answer that, Bill, if another doctor or your own patient reported you.
you know what
Otherwise, it would
Todd
never
is
be
being
enforced.
refreshingly honest here. What I interpret you're saying is this particular law is a statement by the Utah State Legislature.
It's a message bill.
It's a message, a statement. We can't ban abortion, but we'll do this.
I have admitted now 4 times, there is an element of politics in this, like there was an element of politics in the road.
What is your justification for forcing me to violate all of medical ethics?
Well,
I don't believe we're forcing you to
I
do
want
that.
to say one last thing. When we talk about
Utah
maternal
Medical
mortality,
Association doesn't believe that we're forcing you to do that.
one
They
last
do.
thing, we're going to
They
have to
just
wrap
don't
it
say
up here.
So
We're way
when
over
we talk
time.
about maternal mortality in the setting of pregnancy in the early peripartum period, it's about 18 to 20 per 100,000 women, which is higher than it really ought to be in this country. When we talk about maternal mortality related to abortion services, the CDC actually has to use 3 years of the data because it's pretty rare. It's about 0.7 per 100,000 women. One of the number one causes of death for women undergoing abortion is not the surgical procedure, it's the anesthetic. Turns out that's the most dangerous part. So by mandating also additional administrations of anesthetic outside of typical standard of care, and again, this bill implies giving it during labor induction because that is an abortion by all definitions. So now we are increasing maternal risk and maternal risk of mortality in abortion-related care as well. And I think that's something you guys have to acknowledge when you think you have a message bill. This actually affects people's lives.
Let me just wrap things up with this. I heard this the other day. I can't take credit for it, but somebody was positing that if people who are very anti-abortion, pro-life people, really got together and expended their energies working with people who believe in family planning, we would end abortion in this country. It would be statistically, the number of abortions performed would be negligible. If people expended their energies, if they got together and worked together, let's say Planned Parenthood, it got together with people who were anti-abortion, and they said, how can we really use our energies and our creativity together? If abortion is that big a deal, we could make it statistically negligible if we expended our energies toward that.
The good news is that the younger generation, young adults today, are more pro-life than their parents. I think that
I don't think that that's true.
Statistically, it is true. There are recent polling data that shows that that's the case.
I think
That's
they're perhaps
research.
they're certainly less inclined to get pregnant.
They're more pro-life than their parents. In fact, they're the largest age cohort that believe that abortion should be illegal in all situations, which isn't the case here in the state of Utah. That's not what our laws say.
We don't use polls to practice medicine,
But-
just FYI.
But my point is that reducing abortion, that's definitely a goal for a lot of us.
So comprehensive sex ed in schools.
Excuse me, you always asked for me to be respectful to you when you were
apologize.
speaking. So the point is that the younger generation, I think they see the violence of a lot of abortive procedures. They see and understand that, and maybe an element is understanding and better access to contraception, I don't know. But hopefully the trend continues and abortions continue to go down.
Should we do one more quick question here? One more quick question, and then we better wrap this up. We're way over time. What's your question?
My name is Dr. Gail Stewart, and I'm an obstetrician gynecologist. And it seems to me that if you're going to make an exception against giving anesthesia to babies with anomalies, that you're discriminating against a patient with a disability. And that should be something that's federally and universally mandated, that we don't discriminate against people with disabilities. So why would you not give anesthesia to a patient, to a fetus who has a disability in terms of an anatomical defect? That doesn't make sense to me. If you're worried about one fetus, why aren't you worried about the other fetus who has a disability? Okay, that's my first question. My second question is, if a fetus at 20 to 21 weeks has pain receptors, and I'm an obstetrician delivering a patient at term who doesn't want to have an epidural or any anesthesia, am I committing an act of violence against the child who's going to be born by natural childbirth? Why does it not go from one thing to another? And pretty soon we're in a state where all of us are acting against the fetus. I don't understand.
Well,
that is a logic that doesn't make sense to me. Those are my two questions.
Again, I think we'll wrap it up here. Thank you, Dr. Stewart. I think, again, with Todd Weiler's honesty,
There's nothing to do with fetal pain.
this bill is it's a way of saying we don't like abortion. The Utah State Legislature and
I think there
legislators.
is a genuine aspect of concern in the bill as well. I mean, I don't think it's all about a message. I think there's genuine concern. It's a violent procedure. It is.
Labor?
You cannot,
Can I just
no,
address
induction of
the
labor?
We
D&E
cannot go back over this.
Surgery is
We
violent.
are-
That's not what the bill says.
Surgery is violent.
I know, we
Not what the
can't
bill
go back
says.
over this.
Labor
I'm
induction.
sorry, we have to end it here. That's way over the time we have.
Sorry.
I want to thank Senator Todd Weiler for being with us. It's always a pleasure to talk to you, Todd. Senator Deirdre Henderson, thank you so much for being with us. I think you, I hope you feel okay about all of this, and say hi to Dave Owen for me. Dr. Lexi Eller, thank you so much for being with us. Pleasure to meet you. Dr. Leah Torres. I want to thank everybody here at the club at 50 West, including our new manager, Jen Thomas. Thank you to Jake Jensen for scheduling things here. This program produced by Dylan Allred and Corey O'Brien. Our technical staff, Dave Peterson, Trent Anderson, and Matteo Coletti. Join us back here on May 25th. We're going to be talking about Count My Vote. For more information, like us on Facebook, follow us at Think Utah on Twitter, and visit thinkutah.org. I'm Bill Allred. Sayonara.